understanding the new COVID-19 variant that is in the news recently. Our virus is expected to change from, and will vaccines protect against a mutating SARS-CoV-2? The story so far is, a year after the novel coronavirus announced itself in China, there was yet another critical update in December this year: the emergence of a new strain of the virus caused by the mutations that seemed to be 70% more transmissible. Mutations were reported from the different parts of the world, including Denmark, Australia, England, and South Africa. But the rapid domination of the new strain, lineage B1.1.7, in the south of England set off a chain of events, including the curbs on travel and Christmas celebrations in the country, and several nations temporarily suspending flights originating from the United Kingdom has also been taking place. Recently you can see in the news in India. So what is the WHO saying on this new strain of the coronavirus? Speaking about the new English variant, World Health Organization Chief Tedros Adhanom Ghebreyesus cited a basic fact of virology, that viruses mutate over the time, and it is natural and is to be expected. Trying to counter many ill-informed discussions triggered by the panic from the usage of the word mutation, he said the UK had reported the transmission was higher, but there was no evidence that it causes a more severe disease. Ongoing studies will clear the air on this angle. Why do viruses mutate? See, mutation is a part of life cycle of a virus. Once the virus latches onto a host, it begins to replicate and make the copies of itself. During the process of virus replication, random errors arise. One or two protein molecules change, possibly induced by the immune response mounted within the infected people, explains P.B. Rajesh, Vice President, Royal College of Surgeons of Edinburgh, UK. These changes in the genomic structure of the virus can be considered as mutations. Not all the mutations are significant, but those that affect the virus' ability to survive or replicate are much important. How was this new strain identified? See, the England variant was identified in the genomic surveillance by COVID-19 Genomics UK, COC UK, a new consortium that analyzes genome sequencing data from the United Kingdom. On its website, COC UK says mutations arise naturally in SARS-CoV-2 genome as the virus replicates and circulates in the human population. As a result of this ongoing process, many thousands of mutations have already arisen in the SARS-CoV-2 genome. Experts say vaccine will reduce the number of people getting infected, reduce the number of people spreading infection, bring down the number of hosts and the chance of further mutations. Since the virus engaged in the 2019, vast majority of the mutations observed in the SARS-CoV-2 have no apparent effect on the virus, and only a very small minority are likely to be important and change the virus in any appreciable way. For example, a change in the ability to infect people, cause disease by different severity, or become insensitive to the effect of the human immune response, including the response generated by the vaccine. The variant is the result of multiple mutations in the spike protein, the protein of the viral entity, into the host of the SARS-CoV-2, as well as mutations in other genomic regions of the RNA virus. The COG UK reportedly identified one of these mutations as N51Y in the area of the spike protein that binds to a key protein in the human cell, an ACE2 receptor. This was an indication that alterations may theoretically result in the virus becoming more infectious, it said. As of December 13, according to the Public Health England PHE, there were 1,100 cases of the variant identified, predominantly in the south and east of England. The UK government's website explains that backward tracing using genetic evidence suggests that this variant emerged in September 2020 and then circulated at a very low levels in the population until the mid-November. The increase in the cases linked to the new variant first came to light in late November, when PHE was investigating why infection rates in the Kent were not falling despite the national restrictions. They then discovered a cluster linked to this variant that was spreading rapidly into the London and Essex. Can it be detected through PCR test? Does the PCR test done to detect the virus also pick up this variant, or it is harder to detect? Answering the asked questions, Dr. Rajesh says that PCR test is used to identify a number of gene targets and will pick up this variant too. The UK's Chief Medical Officer Chris Whitty has said that the current swab tests are able to identify the new variant. Is it known how a vaccine will react? While studies are on how to determine the impact of the vaccine on severity of the disease or mortality, Rajesh explains why we need to know about the new variant and its implications for the vaccine. But at this point of time, it is unknown. It is still early to be certain. Ongoing work is something we are looking forward to. What does this variation do for a vaccine which will anyway stimulate a broad antibody response? The hope is that it won't be significantly hampered by the mutation. Vincent Rajkumar, hematologist and the oncologist at Mayo Clinic in Memphis, US, however, urges nations to solidar on with vaccination. The worry is whether the vaccine will have an impact on the new variant strain because the amino acid sequence in the spike is altered. But my response to this is vaccines, vaccines, vaccines. Vaccines will reduce the number of people who get infected, reduce the number of people get infected, reduce the number of people spreading the infections, lower the number of hosts, lower the chances of further mutations, and will allow us to get things under control. Vaccines will offer protection from even a mutant virus. By their very nature, they will make a variety of different antibodies and memory cells that will help fight off the infection, he adds. How can you protect yourself? Simply by following the original advice on COVID-19 hygiene, using a face mask regularly, washing hands, and maintaining the social distance with others when in public setting will continue to be the best practical ways to prevent the infection, experts insist.